you for the opportunity to speak today. I have no disclosures. So weight regain post-bariatric surgery occurs in up to 20% of cases and is associated with decreased quality of life, comorbidity, recurrence, increased mortality, and associated healthcare costs. One explanation of the potential etiology of weight regain is weight cycling, when patients experience repeated episodes of weight loss followed by periods of weight regain. This is attributed to physiological adaptations and epigenetic mechanisms. Identifying reliable predictors of weight regain assists with counseling, surveillance, and early intervention for patients affected by this. So our aim was to examine the relationship between early postoperative weight loss, nadir weight, and weight regain following two most frequently performed operations, Roux-en-Y gastric bypass and sleeve gastrectomy. This was a single institution retrospective review of a prospectively collected database, and only primary surgeries were included between 2012 and 2016. Preoperative demographics are known to be associated with risk of weight regain, including age, sex, and BMI were included, and postoperative outcomes and weight measurements were recorded at scheduled intervals of 6, 12, 24, 36, and 48 months. Rates of postoperative weight loss was calculated using the change of BMI from pre-op to postoperative follow-up. Regression models were then used to determine the association between postoperative weight loss with weight regain and nadir weight. Subgroup analysis was performed to assess these relationships within each procedure group. So we had a total of a little over 1,000 patients included in the study. The majority were female, about 77% with an age of 45. Preoperative BMI was 46 for the entire cohort, and this BMI was slightly higher for bypass patients at 47 versus 43 for the sleeve, as expected. When looking at the association between weight loss with change in BMI with nadir weight, we found that patients that had greater amounts of weight loss within the first year postoperatively had a lower overall nadir weight. And these same patients, between 6 months and 1 year with weight loss had a higher correlation with weight regain and medium-term follow-up at 4 years. For patients with greater than 20% of weight regain, that's associated with significant clinical risk and increased recurrence of comorbidities. And so we chose this endpoint and found that, again, at 6 months and 1 year, the odds of increase more than 20% weight regain in follow-up was associated with greater weight loss. So looking between the bypass and sleeve groups, we found a stronger correlation with weight regain between 6 months and 1 year. Okay, so some limitations. We didn't require some chart review, and there was some recall bias with patients self-reporting nadir weights, a nutrition rate that was about 30% in the follow-up, and then variable definitions between weight loss and weight regain. We chose change of BMI for its ease of use, and since we were planning to use this as a counseling tool for patients. And last slide. So patients with increased weight loss at 6 and 12 months may be at a higher risk for weight regain during the 4-year medium-term follow-up period. This could be explained by weight cycling theory, so surgeons need to follow these patients more closely and could potentially offer different treatment options, so behavioral lifestyle modifications, medical weight loss options, or a surgical revision or conversion.